We're just doing a little housekeeping with YouTube here. Trying to make a thumbnail. So what happened was that the first two episodes of this series of podcasts for the universal healthcare benefits is going to be removed because apparently nobody told me that the audio of the DOH videos was turned off. So some things don't change. Yeah. Okay, we are still live. So we're going to get you here with inpatient benefits with nurse Elsa Joy Apales Agipo. So we're going to learn about the inpatient benefits. I'm going to try to explain some. If we need some explaining about this, and inpatient benefits is hospitals. This is what you get when you are in a hospital and you have Philhealth. Okay, so I'm not going to be able to redo the first two episodes, so we're just going to start away with this video. Okay, so yeah.
Isang malusog na Pilipinas para sa ating lahat. In the previous presentations, we have shown you a wide range of individual-based primary care services and other ambulatory care packages which our members and their families may avail of when needed. Now, I will discuss to you Philhealth's inpatient benefits and procedures on how our members can avail such services. Based on the second line of Philhealth's vision, bawat miyembro protektado, we make sure that our members are protected in times of medical needs with a range of inpatient benefits. For illness requiring
Okay, so since I'm going to be deleting the first two videos, you heard what she's just said, that every member of the family, yung bawat miyembro ng pamilya, or every member of the family is going to have benefits, especially inpatient benefits. So this is important because a lot of Filipinos, especially in the grassroots or those who are poorest of the poor, do not know that they have to register first. Okay, that's the problem. So it's important on our side that our constituents in barangays have to be registered to Philhealth so that they can receive the benefits, because if it's not automatic yet, okay, so the national ID system is still being upgraded, so it doesn't mean that right now, it does not mean that if you get the national ID you automatically get a Philhealth membership. So, or if you are born Filipino, you already get the Philhealth benefit. Okay, this happened here in Olongapo when a relative of a kagawad or a barangay councilor was admitted, and she does not have a Philhealth card, no numbers, and then suddenly they were unable to procure the inpatient benefits because it was an emergency. So that was the problem, and they were able to lay out a plan to enroll the patient. However, the benefit of the Philhealth was not availed, or the full benefit for inpatient benefits for Philhealth was not availed during that emergency admission. So it's important that every Filipino has to register to the Philhealth through their barangay health centers or through other points which was discussed in the previous video. So in Senior Citizens Affairs, OSCA, Office of the Senior Citizens Affairs, in various municipality and LGUs will have a point of enrollment for Philhealth. Also, there will be other branches of the LGUs, like in PDAO office, persons with disability offices. They will have points of enrollment for Philhealth. So that's important because those are the vulnerable population. So it's important that we learn this and we have to apply this, because it's not that easily streamlined as of the moment. So we are still in the transition period wherein there needs to be a massive upgrade. So let's just continue with this and then we'll stop if there's something I need to clear up.
Hospitalization, we provide inpatient coverage for confinements of not less than 24 hours through any of the thousands of accredited healthcare institutions nationwide. These benefits include both facility fees and professional fees. Inpatient benefits cover both medical cases and surgical procedures. Patient can avail these services in any Philhealth accredited healthcare institution, such as hospitals and other health facilities, such as infirmaries and dispensaries. Philhealth inpatient benefits cover services such as hospital room and board fees, drugs and medicines, X-ray and other diagnostic examinations, use of operating room complex, and professional fees of attending physicians. These benefits are paid to the accredited healthcare institution through the case-based mechanism, meaning there is a...
So, a few questions here that could come up is, what if less than 24 hours admission? You can still get the Philhealth benefit. Unfortunately, you'll get the outpatient benefit or the consulta package, which was in the previous video that I have streamed. But however, we are going to not going to go back there. I'm going to delete it. So it's going to be like an OPD package, an outpatient package, when you have a less than 24 hours benefit. So how about if it's not accredited healthcare institutions? You can still avail of the Philhealth package. Unfortunately, you have to do it manually in Philhealth offices, and certain labs and procedures may not be covered if they are not part of standard care. Okay, so there are healthcare institutions that I have been able to see that like those that treat patients with alternative medicine. Okay, so if you are given medications that are not part of the Philhealth package, you may not get benefits from that. So case-based payment, fixed rate. So each case is fixed, has a fixed amount, so across all member categories. So let's continue with her.
Is a fixed amount of benefit that members are entitled to. All illnesses now have an equivalent amount of benefit or case rate for ready reference of members and accredited hospitals as well. Case-based payment is the same as case rates. This chart shows some of the medical conditions being paid through case-based mechanism.
So this is important to note. So dengue fever, dengue severe. So dengue fever, dengue severe means that there is bleeding involved, okay, or there is there is need for continuous infusion of IV fluids. So that's important because the hospitalization may go up higher than 16,000 pesos. So in dengue fever, these are just not every dengue fever can I think the dengue fever without warning signs need not be admitted. So this was a problem past, like way back in 2016, where a lot of dengue patients were admitted. So this is the reason why the case rates were lowered from previous, because a lot of patients were admitted with this diagnosis, dengue, okay, with the dengue diagnosis, just because they had fever. So you don't automatically get the 10,000 or the 16,000 if the laboratories came out negative. So there has been problems with inpatients where their case rates were lowered, or they did not receive the inpatient benefits package, because the final diagnosis turned out to be not dengue. But even though the attending physician signed it as dengue severe, the laboratories, the exams were reviewed, and they were not granted the inpatient benefit. So that's important to note, especially here in dengue. So pneumonia moderate and high risk, this is also important, because most of the time pneumonia high risks are those that are in the ICU. So 32,000 is like case ceiling. Okay, so a lot of government hospitals, when you are admitted at the ICU, 32,000 is just equivalent to 3 days. So pneumonia high risk and moderate risk, the management has to follow the the standards put forth in the Philhealth, or otherwise you don't get the inpatient benefit package. So this has happened before, and well, I don't handle pneumonia patients because I rarely admit anymore, but other colleagues that did admit told me that this was one of their biggest problems, because some of their patients did not get the inpatient benefit package because they deviated from the required management. Like, if in cases of moderate risk, you have to go with at least 2 antibiotics. However, some patients come in with culture insensitivity exam results showing that they were sensitive to a particular antibiotic, and they were able to receive just one antibiotic during the course of admission, even though they were labeled as pneumonia moderate risk. They did not receive the inpatient benefit package, or they had they were diagnosed with a high risk, but they were lowered to moderate risk because they lack certain standards. I'm not very familiar with it, but that is what is happening right now. So it's not automatic that a doctor or the attending physician signs the chart as pneumonia high risk. It's automatic 32,000. So most of these cases are reviewed, especially if there is discrepancy, but these are just the ceiling. So hypertensive emergency and urgency, this is also important, because most hypertensive urgency patients refuses admission, or they are not admitted because the government hospitals have are in capacity. So a lot of those patients are treated in the emergency room, even though they stay more than 24 hours in the emergency room sometimes. Okay, they do not receive the inpatient benefits package. Stroke, so stroke, there's a medication that is covered. I think it's Altiplace, so covered by Philhealth. So I have no idea if this is deducted from the case rate. So I can't comment on that, but if you do know, maybe you can comment on the comment section below. Acute gastroenteritis, this is diarrhea. So this is also reviewed by a lot. There are a lot of Philhealth claims. This is also reviewed. So this benefits package, they become a problem with the government hospitals, because when the patient goes home, when the patient is given a may go home signal by the attending physician, the administration section already deducts these amounts in the billing, because they think that they automatically think that they will get the claim. However, the Philhealth usually releases it at least 90 days after the admission. So the funds are released after 90 days. It is reviewed. That's why it takes 90 days, because a lot of cases gets reviewed by only a few people, and then when they get reviewed and they see a discrepancy in the management, some of the patients are not covered by Philhealth. So a lot of patients in government hospitals are diagnosed with acute gastroenteritis. This is one of the top morbidities here in the Philippines. So that's a problem, because when the claims are being consolidated after 9 months, you can find that some of the cases were not reimbursed by Philhealth. So this is one of the problems that we can see right now. So it's important that every physician, just like me, I'm trying to take this course so that I will be able to see or have a solution to the problem of claiming Philhealth benefits. Okay, so that's something that we need to be able to solve in the future through education. So we're going to continue with it. So asthma in acute exacerbation, 9,000 pesos only. When I admit the patient in private hospitals, 9,000 pesos. Usually if it's in acute exacerbation, it has to be admissible. Severe acute exacerbation, 9,000 usually just covers about the first 24 hours. Typhoid fever, I rarely see typhoid fever right now, and it's hard to diagnose, but it's probably required that patients should be tested for typhoid, I guess. But let's just continue with the inpatient benefits. And that's the reason I'm trying to discuss with you this slides, is that these videos goes on very fast, and then Philhealth tells you that you're supposed to understand it already, but that's usually not the case. In actual applications, in actual real world applications, we have problems with Philhealth, because it's required for the sustainability of our local hospitals. So it's important that we get in line with what Philhealth is trying to tell us, but because we need to sustain the day-to-day operations of government or a private hospital. So that's important. Okay, so let's just continue with this.
Reimbursements for hospital and professional charges for these cases are made through the hospitals. Thus, they are expected to provide a complete spectrum of care for the Philhealth member. Also, remember that case rate amounts should be deducted by the healthcare institution from the member's total bill, which shall include professional fees of attending physicians prior to discharge. This means that the member only has to pay the remaining balance if there is any. This is to make sure that Philhealth members are protected from financial risk. This chart, on the other hand, shows some of the surgical procedures also being paid through case-based mechanism.
Okay, so here we go with the surgical procedures. These were the values here were the same as like 5 years ago, so, or 10 years ago. So this is not a lot. Okay, so if you're going to sustain tertiary hospital, you need to charge a little bit, so that charge a little bit, especially if there is a surgical procedure done on the patient, because the amounts here are too low. Okay, and there may be problems with the claims. Okay, so although here in Olongapo we try to do the no balance billing, so it's good, the no balance billing, but the problem with not getting the Philhealth claims is that the local government has to shoulder out the money that we did not get from unclaimed Philhealth benefits. So that's the problem, because it becomes a burden if these surgical procedures are not enough. So even though it's NBB or no balance billing, in our government hospital, in the long run, the administrative section has to find other sources to compensate for those surgical procedures that were not covered by Philhealth. So the appendectomy, 24,000. I think 10 years ago this was 16,000, but right now it's 24,000. Considering the cost of the supplies, the cost of the surgical materials for a simple appendectomy, 24,000 may not be enough. It may only cover part of the procedure. So let's just go and continue. This is something you need to think about, especially if the procedure did not get a claim. Okay, let's go.
In view of DOH Administrative Order 2012-0012 and Philhealth Circular 54 Series of 2012 related to the new classification of hospitals and other health facilities in the Philippines, and on the new Philhealth approach to accreditation, reimbursement of radiotherapy procedures is no longer restricted to levels 2 and 3 facilities. While hemodialysis is no longer restricted to hospitals and freestanding dialysis clinics, as long as these services are within the capability of these facilities are provided for the licenses issued to them by the Department of Health. As part of our benefit reform strategies, we also exempted cataract extraction procedure from the single period of confinement rule, which requires 90-day wait before the second procedure is performed. Thus, for cataract procedures done with a minimum of 1-day interval, claims shall be paid as 2 separate packages. This interval was recommended by the Philippine Academy of Ophthalmology, which ensures that patient safety standards are upheld while making it practical to achieve visual rehabilitation in a timely and efficient manner.
So, historically, this happened way back ago, that because cataract procedures were added to Philhealth, there was cataract procedures left and right, and a lot of them did not have did not wait for the 90 days. The 90 days is actually for the recovery time for the other eye, for the eye that was operated on, so that they can recover and use that eye before you can do the cataract procedure on the left eye. There were other cases where two eyes were operated on, so, and they charged that to Philhealth. That was before. Okay, so there was a lot of problems before. I think this is what happened, why this single period of confinement rule was created, especially for the cataract extraction procedure. So a lot of doctors were able to abuse the system before, but this is correct. You really need to wait for the eye, or the eye to recover before you do this second cataract extraction procedure, and the replacement of the lens. Also, of note is that since I had my mother-in-law undergo this procedure, I was told that the replacement lens was free for a certain brand that was approved by Philhealth. Okay, but you have to shell out some more if you want other brand of lens that will be used to replace the once the cataract extraction was done. So I chose a better lens because the ones prescribed by Philhealth, because of, well, it's not because of the brand, but because there was probably a problem with the patients, because there is a reason why the patients had the cataract in the first place. But those who had the free lens had to redo their cataract extraction procedure a year after, because they fogged up or they were blurry after a year. So that's something that I was able to take note of in practice. Okay, so that's why we chose a better brand, and for my mother-in-law, and I had to be strict with the her maintenance regimen, because the amount I had to come up with, like 10,000 for the superior brand, for the lens, for the intraocular lens that was placed on her right eye.
As mentioned, the benefits are paid directly to the accredited healthcare institution through the case-based mechanism. For medical case, the facility gets 70% of the case rate, while the professional fee is 30% of the case rate. For surgical case, the facility gets 60% of the case rate, and the remaining 40% is for the professional fee. To have a clearer picture, let us cite an example. For medical case, let's say that the member gets hospitalized and the final diagnosis is pneumonia high risk. The case rate amount for the medical case is 32,000. Since this is a medical case, the facility gets 70% of the case rate amount, or 22,400 pesos, and the remaining 30%, or 9,600 pesos, is for professional fee.
So again, this is the problem with this. Okay, so you see case rate is 32,000, 70% goes to the facility. So that 70% is now 22,400. So like I said before, to sustain an ICU bed, usually pneumonia high risk requires an ICU admission. To sustain today, in 2023, to sustain a government ICU bed, you really need to shell out 10,000 pesos. For somebody who has high risk pneumonia, okay, the facility fee only covers like 2 days. Okay, so that's one of the problems. So the one of the solutions to this is to have a more than one medical insurance company, because I heard that the other insurance companies will cover a much higher facility fee, I guess for the higher case rates if you get pneumonia high risk. So, and the only money that they had to shell out is like 300 to 500 pesos per month. Okay, so this is something to consider, because of that, the case rate has to be split into facility and the professional fee. So the professional fee is modest. Okay, so 9,600 goes to the professional fee. So it's actually low, okay, for somebody to have that PF. But one of the things that is being implemented is what is called Philhealth sharing. So there are, since they have many patients, a lot of employees get part of these professional fees actually. So that's something that is done administratively. So that's something that is done in various hospitals, but it depends actually. So there are hospitals that don't like sharing this PF. So but it's more productive for the government hospitals to share this professional fee with other members of the hospital staff. Okay, because if you do Philhealth sharing, other staff members may be enjoined to do their job more. Okay, so it's like an additional incentive to take care of these patients. Okay, so that's one of the problems with Philhealth nowadays. It's not enough to cover and sustain, but it's good enough that it decreases the burden, okay, that the patient has to pay if it's cases that it's not a no balance billing government hospital. So let's continue with the surgical one.
Fee. For surgical case, let's say that a Philhealth member or qualified dependent gave birth through a cesarean section. The case rate for cesarean section is 19,000 pesos. Cesarean section is a surgical procedure, therefore, the facility will get 60% of the amount, or 11,400 pesos, while the professional fee is 40% of the case rate amount, which is 7,600 pesos. Let me reiterate that the whole case rate amount should be deducted from the member's total bill prior to discharge. This means that the member only has to pay the remaining balance if there is any. However, the Universal Healthcare Act stipulates that no co-payment shall be charged on patients admitted in basic or ward accommodation. Now, let us discuss the process by which our citizen can avail of these inpatient benefits. As stated in the Universal Healthcare Act, every Philhealth member and dependent shall be granted immediate eligibility for health benefit package. However, certain conditions must still be met for inpatient benefits.
As you can see there, he had to do some deep breathing there. However, there has to be certain conditions. Okay, so if the conditions are not met, the packages, there may be unclaimed Philhealth packages, which will burden the LGU. So let's continue.
First, they must be confined for at least 24 hours and the case is admissible.
Okay, confinement means in the ward, not in the emergency room. So a lot of patients do not understand this because of the triage system we have now. A lot of the patients are admitted in what we call triage rooms for a few hours before they get to the emergency room, and then from the emergency room they get admitted to the ward. So the time frame is actually on the time that they are admitted at the ward. So I think the isolation rooms are also considered as ward type admissions. So that's when they start counting for the 24 hours. So something to think about, because a lot of people do not know that emergency room admissions are not actually the confinement that is you can avail of inpatient benefits. Okay.
Second, they must be confined in Philhealth accredited healthcare institution.
Okay, so this is a problem if the institution lost its Philhealth accreditation or did not get accredited for the year, and you got admitted there. So there are some instances like that, or this is an alternative medicine hospital, those that are palliative care, those that treat palliative care patients. That's the problem with this. So it's still possible if you can go to the Philhealth office to get the inpatient benefits.
Third, the attending physician must be Philhealth accredited.
Okay, so this is the reason why even though I'm a government doctor, I have to pay for the patients to get benefits in Philhealth. Okay, so I have my own Philhealth number. That's why that previously this was not the case. No, when a doctor is licensed by the PRC, you can choose not to be Philhealth accredited. Okay, but right now it's important that the doctor gets Philhealth accredited, because the patient, usually all of the patients that he will see, will have a Philhealth number, and in order for them to get benefits, you have to pay out to get accredited.
And lastly, needed documents must be secured. This includes updated MDR or member data record or Philhealth benefit eligibility form and duly accomplished Philhealth claim form 1.
Okay, so that's something that a lot of Filipino patients don't understand, why in the ICU relatives are asked by the hospital administrative staff to fill out the forms. Okay, those forms will be the basis for the claims. Okay.
It is noteworthy that Philhealth ID card shall not be required in the availment of health services.
Yep, because you may be in an emergency. So in an emergency, it's not required that you carry it around you. What's important is that it's somewhere safe. The number is important. The Philhealth number is important, and can be written in a piece of paper, so that when you get admitted, your relatives can get this number signed in this MDR or member data record form to update it, so that they can be submitted to get the inpatient benefit package.
Also, failure to pay premiums shall not prevent the enjoyment of any program benefits.
Okay, so the premiums, there's this monthly premiums that have to be paid, so that the Philhealth fund can sustain itself. Okay, so this is how claims are paid out, because new members have to give out their money. So it's like a big fund. Those who get sick, they get paid. Their hospital bills get paid. Okay, so that's important. But unfortunately, there are those that cannot pay the premiums. So the premiums can be paid in a later date, so that they can avail of the case rates. Okay, of the Philhealth case rates.
However, for the employers and self-employed direct contributors, they are required to pay all missed contributions with an interest compounded monthly of at least 3% for employers and not exceeding 1.5% for self-earning, professional practitioners, and migrant workers. For inpatient benefits, the 45-day benefit limit in a calendar year and another 45 days to be shared by all qualified dependents also applies. Each confinement days will be deducted from the 45-day benefit allowance. While all admissible confinement shall be eligible for inpatient benefit package, the rule on single period of confinement must be followed.
Okay, so 45-day benefit. So if you get admitted more times in a year, you get about 45 days to get 45 days that you can get the benefits. So this rule is new, especially since the start of the COVID pandemic. We have admitted patients that lasted about 2 months because it was previously required that the RT-PCR be negative before they get discharged. Okay, so let's go ahead.
Single period of confinement means that no same illness shall be availed of within 90 days. The situation stated in the slides illustrate the single period of confinement rule. For the first scenario, a member was admitted for the first time because of pneumonia moderate. A few days later, the member was admitted again for the same case. Because of the single period of confinement rule, the member cannot avail the benefit because he or she was admitted within 90 days of the same illness.
So it's important that the patients know this because a lot of them, because of the bill stacking up in moderate, right there usually is about 500 times 315 per day. The patient usually signs a HAMA agreement. They want to go home against medical advice because they want to drink the medicine. They get a bit better, but that's what happens. If they get worse at home, they will not be able to get the benefit package. That's why we don't encourage HAMA, but because of the patients themselves, because they think that it's the best course of treatment because they are already financially burdened. They usually sign the home against medical advice forms. So that's a problem. That's the problem here. So that's why there's this single period of confinement only.
For the second scenario, another member was admitted for the first time because of pneumonia moderate. A few days later, the member was readmitted for pneumonia high risk. According to the single period of confinement rule, the member cannot avail the benefits because he or she was admitted within 90 days with the same illness, even if with different risk. Lastly, for the third scenario, another member was admitted for the first time because of dengue. 2 months later, the member was admitted again due to typhoid fever. Based on the single period of confinement rule, the member can avail the benefits because he or she was admitted with different illness. There are some conditions and procedures exempted from this single period of confinement rule, such as OPD blood transfusion, cataract surgery as long as there is a 1-day gap between procedures, hemodialysis and other forms of dialysis, radiotherapy, simple debridement, brachytherapy, chemotherapy, and asthma in acute exacerbation. This concludes my presentation on the inpatient package of Philhealth, which emphasizes the benefits covered, case rate computation of the benefits, and the process of availment such services. Maraming salamat po.
Okay, so that's lecture 3, lesson 3, inpatient benefits for the universal health care. I'm gonna have to stop right here, maybe we could discuss a little bit more that in the next stream. So just right now, I guess the next stream will be about, let's see.
Good evening, ma'am. Ano pong kaso niyo, ma'am?
Oh great, they logged me out. I can't use it. So that's it. I guess thank you very much for watching. I hope you liked this video, and I hope that you have questions. If you have questions, you can write them down below. Okay, so I have to go since I'm actually on a duty. So I guess I'll see you guys. Thank you very much for watching, and peace out.